time, let's revise dengue fever. First of all, dengue is the most common arthropod-borne viral infection in humans. Dengue virus is transmitted by the bite of infected female Aedes mosquito. Let's move on to the most important part, which is clinical presentation. For clinical presentation, we should know the incubation period of dengue virus. Incubation period of dengue virus is 3 to 14 days. On average, it is 4 to 7 days, and symptoms occur after 2 weeks. A person departs from an endemic area. Fever lasts 2 to 7 days and may reach up to 41 degrees Celsius, which is around 104 degrees Fahrenheit. Fever which lasts more than 10 days is not due to dengue, and we should go for other lab investigations in order to know the cause of the fever. And most commonly we will see fever, headaches, retroorbital pain, arthralgias, myalgias, nausea, vomiting, rash, anorexia, a little bit sore throat, and mild hemorrhagic manifestations can also be seen in dengue fever. Mild hemorrhagic manifestations can cause petechias, bleeding gums, epistaxis. After that, we can also see some extent of lymphadenopathy in the patient. The rash in dengue can be maculopapillar or macular rash over the face, thorax, or flexor surfaces. Rash begins on day 3 and persists for 2 to 3 days. The pattern of the fever in dengue fever is saddleback fever, which means that fever can settle for some time and it can come back again with the same severity. Now we will move on to the differential diagnosis. In differential diagnosis, we can suspect influenza, malaria, Zika virus, viral hepatitis, meningitis, immune thrombocytopenia, scarlet fever. In lab diagnosis, we can go for demonstration of 4-fold or greater change in reciprocal IgG or IgM antibody titers to one or more dengue virus antigen. We can go for ELISA. We have different types of ELISA. We have MAC ELISA. After that, we have IgG ELISA, and the last one is NSI ELISA. We can also go for PCR, and we have a very specific PCR for dengue fever, which is reverse transcriptase PCR. After that, we can order CBC. CBC will show us thrombocytopenia with a value of less than 100 into 10 per 9 per liter. We can also see leukopenia. And LFTs, we will see mild elevation of alanine aminotransferase or aspartate aminotransferase. If we go for metabolic panel or electrolytes, we can see hyponatremia in most of the cases. In some cases, hematocrit level increase greater than 20%, which is a sign of hemo concentrations and precedes shock. So it is very important for the doctors to order hematocrit levels every 24 hours. You can also go for a test of occult blood in the stool. And in patients with dengue hemorrhagic fever, there is increased hematocrit levels due to loss of fluid in this third space. We can see hypoproteinemia, prolonged prothrombin time, decreased fibrinogen in patients who are suffering from dengue hemorrhagic fever. The treatment, we can go for oral rehydration or IV for volume replacement with isotonic fluids such as ringyl lactate, which should be stopped when hematocrit is below 40%. If a pregnant lady comes with dengue, we should always rule out preeclampsia. And for the other things such as pain and fever, we should advise the patient to rest, and we should give acetaminophen, which is paracetamol. And we should always avoid aspirin, salicylates, and NSAIDs in dengue fever. Prevention, we can give dengue vaccine in individuals who are aged 9 to 16 years, but it is only approved when the patient is previously infected by dengue. Other prevention methods are mosquito sprays, nets, and we should ensure cleanliness all around the house and outside the house as well, such as public parks, and we should not let water accumulate in any areas. Thank you so much for watching. Allah Hafiz.